Okay, Shanna Houston. I'm getting ready to start my lipodrop regimen and was wondering if there are any drug interactions I need to be aware of, such as taking Vyvanse. No, Vyvanse is a great medication, and the lipodrops regimen does not have any stimulants in it, so it is perfectly compatible with any medication, any treatment regimen, any disease state. So you don't have to be concerned about that. You start the lipodrops, you put it under your tongue, you hold it under your tongue for 2 minutes. That is where it is absorbed and that is where it works. You don't even have to swallow it. Once you've held it under your tongue for 2 minutes, you literally could spit it out. And that was one of the things we actually used to recommend in its initial iteration. That's because it wasn't pleasant tasting. But now I've changed the formula so now it tastes pretty good. And so you can taste it and swallow it without any problems or backlash. But it literally does nothing in your stomach. The way the lipo drops work, the liquid drops, is that they absorb under the tongue, and that is the equivalent to getting the same medication via a hypodermic needle or a shot. That was the reason that this was developed, because people would come to my weight loss facility to get shots, and they would have to come every 1 or 2 weeks. And everybody does it initially, particularly once they start to have success. But over time, they start missing appointments and not coming for whatever reason, and then they start to lose the benefits. But with the lipo drops, you got a month supply. You don't have to worry about coming back to the office. You got enough to last you for a full month, giving yourself a dose 3 times per day. That's one with breakfast, one with lunch, and one with dinner, and you will optimize the benefit. The medication that doesn't work is the one that's sitting on the counter, sitting on the shelf, or sitting on the table. You actually have to take it, and you have to take it appropriately. We put out a video a few months ago that clearly demonstrates the appropriate technique for taking it, because people would take it, squirt it under their tongue, swallow it immediately, and then say, I've been taking the lipo drops and I'm not losing a lot of weight. Well, that was why. So we decided we got to be quite clear in the appropriate methodology for taking the lipo drops. And then once people do that, you are going to lose the weight. It's going to happen. And it's going to be the right amount of fat versus muscle. Great question.